Today, the role of AI in pathologic diagnosis is in its infancy. There is no reliable solution that can replace the pathologist in routine diagnosis. There are some hopes with the use of these technologies, rather to assist the pathologist in that everyday routine than replace them. So this is not the subject of replacing the pathologist, but just to assist them and to improve their accuracy for the diagnosis. And the problem of AI is that the reproducibility of the result published. There are many manuscripts all of, in the literature, and the difficulty is that to reproduce the result published by the others. So we need a kind of standardization of the result and to working on the same solution and with the same tools. This is not the case today. The advantage of use AI is to deal with a huge amount of data, which is the main property of the AI solution, is to handle huge amount of data and data sets. So today we have no other way to manage all this information. The AI solution are very useful for that, but we have to be very careful in the use of this solution to obtain wrong conclusion on the results and to control the data set, which is the most important thing. Now, there are many hopes with this solution. We have to be very careful in the use. This is not a magic, and we have to be very practical in the use of this solution. It's rather an assistant than a replacement of the doctor practice.